Thank you. Yes, I'll introduce myself. You don't already know me. I'm Mayor Brian Waller, and this is Sharon, Third Ward Councilman Sharon Carmichael, Councilman Frank Earn, who actually lives here, and our former County Commissioner Camille Fernicola is here in New York. And if any other officials, and we also have our local state senator Robert Smith here, and our local state assemblyman Joe Davis in here. And obviously, the host today is Congressman Blown. So, Congressman, do you want to start off? Or?
Yeah, sure. Well, you're the host.
Thank you for having me here. And I always love to come to the Piscataway Senior Center because it's such a beautiful senior center. And there's always a lot of people here, no matter what time of day it seems. And there's always a lot to do. So, and also, you usually participate with a lot of questions. I'm just going to speak briefly, and then I'll ask if our state legislators would like to say a few words as well. But the main thing we wanted to do was to open it up for any questions or comments that you'd have. So let me start off by saying this. I was very concerned, and the focus of why I'm here today is that a few weeks ago in Congress, a bill was passed, and I have to say it was totally partisan, right? In other words, every Democrat voted against it. I think all the Republicans but one.
Can you hear me?
They're blocking. It's okay. They're here with the camera, so they
let me
guys
get
can
closer
hear.
to this mic.
You're operating the button?
So what I was saying is the main reason I'm here today is to explain the impact of this bill that was passed a few weeks ago in the Congress, but it was very partisan. So every Democrat voted no, all but one Republican voted yes. So it was a totally partisan bill, which is unfortunate because I don't like to see things done that way, but that's what it was. The Republicans are in the majority, both the House and the Senate. Of course, the president is Republican. And they passed this bill as a cornerstone of their legislative initiatives for this Congress. The reason that I'm here is because this bill, in my opinion, has a very negative impact on seniors. It has a negative impact on the nation's healthcare in general. So I don't want to act as if it's only seniors, because it actually has a negative impact on the healthcare for the whole country. But I did want to talk primarily today about how it impacts seniors, but I will touch on some of the other aspects. Now, all this, the impact on the healthcare system is all because of cuts in various programs, cuts in Medicaid, cuts in Medicare, cuts in the Affordable Care Act or Obamacare, cuts that impact hospitals and nursing homes. The list goes on. And all this was done in order to pay for tax cuts, if you will, mainly for large corporate interests, large corporations, and the wealthy. And I mean really wealthy, billionaires, multi-billionaires,
Not the average person, not even upper middle class. Okay. You might say, well, why do they do that? Well, I can't speculate why the Republicans are doing it, because I think that a lot of them said before they voted on this bill, including the three from New Jersey, the three congressmen Republicans from New Jersey, that they were not going to make these cuts, but in fact they did. And let me just get into some of the ramifications of it. The aspects of it that probably are the most devastating right now don't necessarily impact seniors, and that's the aspects of it that deal with Obamacare, the Affordable Care Act. Most people who get their health coverage through the Affordable Care Act, because they don't get health coverage on the job. I'm talking about people under 65 or who are not on Medicare. Most people get their health coverage through their employer. But if you don't, because you work in a job where the employer doesn't cover it, then you go on to the Affordable Care Act, we call it the Marketplace, and the federal government provides a huge subsidy to pay for it. So there are a number of people right now maybe make about $35,000 a year for a family of four. And you might say, how the hell do you even exist on that in the state of New Jersey? But there's a lot of people like that, and they don't get coverage through their job. And so they go on the exchange, they buy a health insurance policy through Obamacare, and 90% of it
or on a sliding scale gets paid for by the federal government. Most of those subsidies for people who are making that level of income, so, 30,000 up to say 85,000, are going to lose their subsidy. So if you're paying $100 a month now for that insurance, you'll be paying maybe close to $400 a month, which is huge. And we know that as a result of that, about 5 million of those people across the country will simply not get insurance because they can't afford to go from paying $1,200 a year to $5,200 a year. Okay? Now that doesn't affect you because these are people that, are under 65. Okay? But there are other aspects of it that have a major impact because of the fact that this bill is primarily paid for not through the cuts in healthcare, but through deficit spending. In other words, the federal government, unlike these guys, at the state level, they can't do deficit spending. If they want to pay for something, they got to pay for it with a tax, right? But at the federal level, we put a lot of money, I call it on the arm. We just say, we're going to spend the money and we go into debt, right? We have a provision in our budget called sequestration that says that if you go above a certain level with your deficit spending, then there's an across-the-board cut. And that across-the-board cut under this bill is 4% to Medicare. Okay, so now we're getting into seniors because now we're talking Medicare. 4% across the board cut. Now keep in mind, inflation every year keeps going up, right? If you're talking about a 4% cut to Medicare, what does that mean? That means that the nursing home, the hospital, the community health center, anybody who's a provider, the doctors, right? They all get under Medicare 4% less, right? Now, what does it mean? It means that some providers will simply now, doctors, may say, well, I don't want to take Medicare. Or the hospitals have less money, or the nursing homes have less money, so they close, or they provide less services, right? And that impacts all of you, because this way, if you go to a hospital or emergency room, there's less services provided, less money to do whatever, clean the place, provide whatever it is that they're providing, right? Now, the other major cut is to Medicaid. Medicaid applies to everyone who's below a certain income. And for seniors on Medicaid, this can have an impact in a number of ways. First of all, most seniors who are in nursing homes are on Medicaid. Medicare only covers nursing home care for like the first 6 weeks. Then you're on Medicaid, right? And the problem with Medicaid is as the cuts to Medicaid kick in, and I could go into the various ones, then the nursing homes get less money. So what we're fearful is between the Medicare cuts and the Medicaid cuts, that ultimately either nursing homes or hospitals, some will close, or they're just going to provide less services because they don't have the money. And I don't want to get into, I was going into this a little with our state legislators who like to say a few words. A couple examples of how those cuts impact nursing homes, hospitals, and all of you. Home health care also. Well, right now, the state has what they call a provider tax, which is they tax these providers, whether it's a doctor, the hospital, the nursing home, and then they give them a lot more money back from what they tax them. It's called a provider tax. This bill cuts that every year for the next 10 years to the point where it's practically zero, which means that this huge infusion of funds that these institutions gets reduced every year. Instead of an increase for inflation, it keeps getting cut. Also, when nursing homes or hospitals are failing, or there's a threat of failure, oftentimes the state will simply give them direct money so they don't fail, so they don't close, right? And that also has been impacted in the sense that it's going to be much harder for states to actually do that. Now, there's a bunch of other things. I don't want to get into all, but I will say another example, which maybe doesn't affect people so much here in Piscataway. I mean, you have some homes in Piscataway that are more than $1 million?
Yeah.
You do? It's not that
Well, they are now being built.
Right. So, right, you know that we have what they call a spend down. So, like, if you're eligible for Medicaid, like say you're in a nursing home, you're on Medicare, the 6 weeks expire, right? If you're above a certain income, you just have to pay outright for your care. But very few people do that because it's so expensive. But what they do is they'll go on Medicaid to pay for the nursing home, right? But we're not allowed to touch their house. So in other words, their house cannot be seized or taken to pay for Medicaid. It's called a, oh, Bob, you know what I'm talking about, spend down, right? The spend down provision.
Yeah.
They changed the law into this, so if a house is worth more than $1 million, it can be taken. Now that, you know, maybe in South Dakota, nobody cares, but it impacts people, because as the mayor said, you're starting to get people that have, and there are a lot of people that have a home that's worth $1 million in my district or more, but don't have much income, right? And so this allows the federal government of the state to take the home if it's worth more than $1 million, which I think is a terrible thing. And the last thing I'm going to mention too is that, and again, it doesn't affect New Jersey, but I want to mention it. New Jersey has a nurse staffing ratio. You guys were involved with that, right? So that there has to be so many nurses and staff at a nursing home at any given time, including overnight. We had that at the federal level, which was the reason why a lot of there were states like New Jersey that didn't have it. I think New Jersey passed it before the federal government did, right?
Yeah.
But they repealed that in this bill because they saved like $30 billion by repealing that. All these things that I'm telling you were being done in order to come up with about $1.5 trillion in savings to pay for these tax cuts for the large corporate interests and the very wealthy. But even that was only about $1.5 trillion. There's another 3 or 4 trillion that's deficit spending that's caused the Medicare cut across the board of 4%. Now, I've said enough, and I'm sure I sound very bureaucratic, but the point I'm trying to make is this was totally unnecessary. This shouldn't have been done, and you're going to maybe not see it right away, but you will eventually see the impact of this because, and I have only touched the surface, there's so many other things that impact healthcare and impact seniors. But I'm going to leave it at that. I'm not trying to put you guys on the spot, but I'd like you to say a few words if you want. Go ahead.
So,
On the state legislative side, we're required under the Constitution to pass a budget by June 30th of every year. And I will tell you this year on June 30th, we passed a balanced budget of $58.4 billion. A lot of money, but not in comparison to our medical needs. And what the legislators agreed with their leadership is we don't know what the impact of the Trump cuts are going to be, or the Republican cuts are going to be. So even though the normal cycle would be that there wouldn't be a session until after the election, both of the leaders have said we may have to come back into session and take a look at our budget again. Mm-hmm. And the reason for that is you're our citizens, you're our constituents. It's your money. And I would not be surprised, especially as more information gets out, as citizens of New Jersey get to know what was in the biggest, ugliest bill ever and how it's going to impact your lives and your health, that we do have another session and the budget gets modified. In that $58.4 billion, we left inside of it a $7 billion surplus. And we did it because we knew help was on the way. And now we're starting to find out exactly what it means. What the congressman said, as I understand it, is the people who are going to get immediately hurt are the people who are on Obamacare. Mm-hmm. That happens this year, 2025. The bill was done in such a way that the heavy cuts to Medicare and Medicaid occur after the 2026 federal election. Gee, I wonder why. But what it emphasizes, again, I don't know how many times I can say this or how many times I've said it in my governmental career, elections have consequences. And if any of you told me they knew that this was what was going to be the consequence of the Trump administration or a Republican Congress, I'd say you're a liar. All right. I mean, even though I'm in the opposition party, never expected the dismantling of the federal government or dismantling programs that are essential to the quality of our lives. And for some of it's life or death. So serious cuts, serious challenges ahead. But the legislature is going to try and do whatever it can do to help people survive this. And if you don't vote in 2026, I don't want to see your face. You shouldn't be here, all right, because of what's happening to you as a group, and for that matter, to America as a group. So we don't know the extent of what needs to be done yet, but every day, as people analyze this bill, they're finding out the terrible things that are in it, and we're going to try to help. But like everything else, you want us to help, we should help, but there's only limited money. All right, you can't help more unless you get more revenue, which means more taxes. And I don't think there's anybody in this room who said raise a new tax. Right? That's not a good thing. So right now we're on hold, watching what it all means and seeing how New Jersey can help. And that's where the legislature is. And I think Joe might have his own point of view as well.
Yeah, and let me turn over to Joe, but let me just say this. When I talked about the Obamacare, which again doesn't impact you because these are people that are younger, right? But you have children, you have grandchildren, right? As do I. The Obamacare cuts, where people don't get the subsidy to pay for their health insurance, right, that they buy. I said for many who are paying $100 a month, it's going to be next year maybe close to $400 a month, right? That is actually has to be filed with the state insurance commissioner, those health figures, in August, which is almost here. And then they'll be advertised in November when people sign up or re-sign up. So they will be hit with that immediately, January 1st, right? The state commissioner of human services, I think, estimated that over the life of this bill, the cuts to the state of New Jersey would be about $3.5 billion a year, right? So when Bob is saying,
10.
right, when Bob is saying that your budget is
58.4.
and your surplus is, whatever, you're talking about 3.5, right? Now, I don't know that that's happening this year, but it will happen for next year's budget. A lot of that will kick in for next year's budget. And it's estimated about 350,000 people who have Medicaid, once that kicks in, which he says is until the following year after, would lose their coverage. I mean, I know I sound like such a naysayer here, but I mean, we're just being honest. So go ahead.
Thank you, Congressman.
Senator Danielson.
Good morning, everyone. I'm Assemblyman Joe Danielson. I'm honored to be up here on the panel with such powerful, experienced representatives.
Does that mean we're old?
No, but it's a very valuable trait that you have, and it's irreplaceable. Many of us saw this coming well before the presidential election, and this not only worries us, it scares us, because the impacts you're going to see are going to be not only in your living room, but in your grocery stores, the gas station. It'll be in the emergency rooms, the nursing homes, even in these community centers. You're going to see less and less and less if we don't stop this runaway train. And there's only so much the state can undo from the irresponsibility of this president. And Senator Smith was right. Elections have consequences. And I always said you should pick your representatives like you pick your doctor. Who's going to deliver for you? Because why would any responsible representative want to take away from senior citizens? The most valuable thing you own is tomorrow. And if they're trying to destroy them all by taking away health care or services or housing or education subsidies, they're trying to destroy your tomorrow. Where I know the panel next to me with the experience, you have such dedicated and talented experience to my left. Your mayor, your senator, your congressman, you're some of the luckiest people in the country. But they can only do so much. Elections have consequences. Luckily, we have a fantastic relationship where we are communicating, synergizing, planning, and executing plans. But that all those plans start and end with you, and it's just disastrous. Like for myself, when I was 17, I joined the Army. When I was 26, I became a volunteer firefighter. When I was 49, I became a state representative. It was all to serve and protect. And the same is true for our mayor, our congressman, and our senator. But that in Trenton, all he's doing is serving the billionaires that will never show up to your family picnic. So I'm not going to come across as an expert on Medicare or Medicaid. I'll let the congressman be that expert. But just know that you should have the confidence that your tomorrow is being worked on by us and all of our partners, from the town council, the county commissioners, and all our Democratic representatives in Trenton. Thank you.
Thank you, Joe. I want him around because he says how talented we are and how smart we are and hardworking we are. Thank you. But Assemblyman mentioned one thing that I wanted to kind of hone in on, and then we'll turn it over for questions and that or discussion, is that he mentioned the emergency room. Most of what I talked about today were direct cuts. Right. In other words, across the board cut to Medicare, less amount of money going to hospitals and nursing homes directly from the federal government through the states. But I bring up that point about the nursing homes, about the emergency rooms that Joe mentioned for this reason. When we talk about people losing Medicaid or losing their health insurance with the Affordable Care Act, what that means is that those people, rather than seeing a doctor, will show up at the emergency room because they don't have insurance, right? They can't go see the doctor because they don't have insurance. And so what happens is that emergency rooms not only become overcrowded again, but also the hospital isn't getting reimbursed for that service because they're not getting the money from the federal government through Medicaid or Medicare or through private insurance, like Obamacare is still private insurance, right? And so therefore, now their what we call uncompensated care goes up. And so therefore they have less money to provide for services. And so that impacts their ability to function. Maybe they can't even stay open, or they can't provide the same level of care or quality of care or services. So that's sort of the indirect aspect of this. And that affects seniors too, because, okay, maybe you're not affected because you're still eligible for Medicaid based on your income, but if there's fewer people, if there's fewer payments going to the hospital, then they can't provide the level of services to everyone. It doesn't matter whether you're a senior or you're a child or whatever you are. So you want to...
I want to give the local perspective from municipal government. I don't know if everybody's reading in the newspapers lately that, the state health benefits plan has some problems there. And by having the potential impacts on Medicare, that will impact that. And that will impact the medical insurance that we provide for the local employees here that work in local government. And that's throughout the state. And the reason why I say that is because we have employees still that are on Medicare. That becomes the primary, and the municipal becomes the secondary. And if they're going to have reductions at the Medicare level, that's going to impact the local budgets of local municipalities to provide health care for their employees. And that'll have broad implications for both the state workers too, the senator and the assemblyman. So it's just not, everybody in this room. It's all encompassing. This has broad ranges that tentacles on this bill that most people haven't put their hands around yet. And I gotta wonder, Congressman. It's one thing if they were going to do this bill without the tax cuts and something, but I gotta believe that, obviously I'm not Medicare eligible. I'm not there yet. At some point in time I will be. But this bill is on the books for 10 years. So if you're, say, 56, 57 right now, you should be very concerned, as well as anybody who's on Medicare right now, because you will be impacted from this bill. So somebody who may be in their late 50s may say, that's not affecting me right now. This pay, guess what? Time creeps up on you very quickly. And just like your primary care providers tell you to be, watch what you're doing because, for your medical, this is one of these things that can have a broad impact. And we're also concerned, I know there's nobody from Board of Chosen County Commissioners here yet, but this has a potential impact in the County Board of Social Services too, this bill, because at the county level, the county government administers a lot of these programs that are being cut. So there would be less services involved to provide at the local level. So if you use social services here in Middlesex County, and you're a Piscataway resident or not, you go through the county government to get some of these social services. So these all have broad implications, Congressman, not just at the state and federal level, but right down here to at the local level. So
No, absolutely. And remember, we're only talking about healthcare today, right?
Yeah.
The biggest problem with the counties is going to be with the SNAP program.
Yes.
Because in the same way that Medicaid and Medicare and the things I told you about have been cut, the food programs have been cut dramatically. So
which it impacts this building right now.
Right.
This facility, I'm working in conjunction with the County Board of Social Services, provides for 5 towns in Middlesex County. We're the central hub to take care of 5 communities, not just Piscataway, but several other communities. You have impacts on those programs. Are we going to be able to take care of homebound seniors?
And SNAP itself is
Yeah.
cut significantly. So people that depend on, some people still call food stamps, those are cut dramatically as well. And that's administered through the county. So if the county wanted to make up for it, they would have to raise their county property taxes to pay for it. And Middlesex might do it because they're a caring, progressive place, but they're not going to do it in Alabama. That's for sure. And those people are going to go hungry. But the other thing you said, I don't even want to, some of these Republicans are so bad. The more moderate, if that's the word, as they describe themselves in New Jersey, the 3, some of them said, well, don't worry about it because the effects of this over the 10 years get worse every year, right? Yeah. And so, what is his name? Jeff Van Drew, who's one of the Republicans who voted for it from New Jersey, he said that, don't worry, because we'll have a change, we may have a change in the House majority and a change in 2 years and a change in the presidency in 4, and they can correct it.
Yes.
Yeah, we're gonna vote Jeff.
I was like,
Well,
you mean to say they could correct it?
No, it's not, sir.
Take question.
Oh, yeah. Let's go
We
to
finished.
questions. I'm sorry.
I'll
let you.
It's only 15. Hold on. It's only 15.
No, it's okay. Let's go to
15 minutes.
questions.
Relax. Calm
All right,
down.
we're going
Life's
to go
too
to
short.
questions. Go ahead. Go ahead. You want to be the moderator for the questions?
Catherine,
Go ahead.
I had a question.
just raise your hand right
I
there.
have a question regarding health coverage. When you say that the hospitals, because they're getting fewer payments and reimbursements, will cut their services, I'm thinking, if I were a hospital administrator, I want to stay in business, am I going to do that? No, I'm going to raise my rate.
Oh, exactly. Sure.
Then those that have health insurance through their employers are going to find their rates are skyrocketing. This is going to affect everybody.
Correct.
Not just seniors.
No, I think you're making a point. In other words, what happens is if the hospital, we use a hospital, but it could be doctors, could be nursing homes, could be community health centers, but we'll use a hospital. So the hospital gets more people that come that don't have insurance, right, because of the cuts in Medicaid or ACA. Now, they can, one of the things they could do, I kept talking about they'll cut services, they'll close if their budget is bad, but they could also just raise costs, raise rates, and that impacts everyone. We're about over 60% of the people now get their insurance on the job. And so those rates would go up. And the Congressional Budget Office emphasizes that that's likely to happen across the board. And so it does impact people who even have insurance through their employer, not just people who are on Medicaid or Medicare or people that are on, some government insurance. It does, absolutely.
And I think, Congressman, that is a delicate balance that with that substantial cuts to Medicare, it affects the overall health insurance and reimbursements, which affects both the state and the local governments here. So it's not just you personally, it's all the governments that provide the services for you right there. So, ma'am, go ahead. Just state your name.
Joanna Berger from Rutgers.
Okay.
How much of this can actually be reversed? How much of it have they put in a way that there's less staff and less expertise and that we can't recover? How much of it can be reversed?
Well, I mean, everything can be reversed. I mean, I don't want to keep mentioning Jeff Van Drew, but he was the one that came out and said, well, we can just reverse it if it gets worse. It can be reversed by a future Congress, sure. At one point, President Trump actually said, well, maybe we should just put all of this in deficit, right? In other words, what was happening is the Republicans in the Congress on the right were demanding that cuts be put in place in order to pay for this tax cut, right? Trump at one point suggested we could all be just deficit, just put it all on the arm, and we don't have to make any of these cuts. And I'm not saying that was a good thing either, but he sort of suggested that at one point. Let's just put it all on the arm and all these tax cuts, and we don't have to cut anything. But the Republicans on the right insisted that there be cuts because they didn't want it all to be deficit spending. So sure, you could reverse it. You could reduce the tax cuts. You could reverse it and put more of it on the arm, but that's not likely to happen in the next couple years. And I kind of resent when a Republican who voted for this comes back and says, well, we can correct it later because maybe we'll have a new Congress and a new president. Well, what the hell is that? But sure, anything can be reversed at some point.
Did you have a question? Just state your name.
Yes. Basically,
Here, go ahead. Just stand up, state your name.
Basically, the whole panel is politicians.
Yes.
Have you ever run into an occasion where your conscience conflicts with advancement and party loyalty?
Well, look, I have to be honest with you. I am maybe this doesn't answer your question, but I do believe that there should be, that the government has a responsibility to provide health care. So if you can't afford it, either because you don't get it on the job or because you don't work or you're a senior, I think the government has an obligation to provide health care. That's my basic view, right? I don't know that that's a Democrat versus a Republican view. Now, there are a lot of Republicans who feel that the government should provide health care for people who need it and can't afford it. But there are also many on the extreme right who don't believe that that's a government responsibility at all. So I think when you talk about healthcare, it's not necessarily D versus R. It's what you think the government should do. And I personally think that we, if it were up to me, and I don't have the votes, I would have a national healthcare system.
So there's extremists still on the left.
Right. But what I'm saying is,
when you vote with them, like you say, it's a party line vote. You party line it too, to the left.
yeah, but I'm telling you that I'm probably much even further on the left than maybe you realize, because I would have a national healthcare system like they have in Japan or France or Italy. I wouldn't even, you see, part of the problem here, and I don't know if you want to get into this today, but you started, is that, I keep talking about all these things, Medicare, Medicaid, ACA, private insurance. We didn't even add veterans insurance, Indian healthcare. I mean, we have this patchwork of things in this country that I think is very confusing for people, and I don't think is even good. I would rather see some kind of a national healthcare system like we have in most developed countries, where the government basically provides the healthcare and you don't have to worry about whether you're eligible for Medicare, Medicaid, or whatever. That's probably a more left-wing position than even a lot of Democrats.
Do you believe money will solve all our problems?
No, but I do think that healthcare should be seen as a right, not as something that, you see, it's kind of like what you were pointing out. In other words, people get sick, and it doesn't have anything to do with whether you have insurance, whether you're rich or poor. It's like the COVID situation, right? If we look at healthcare and we say, that it's okay if people get sick and they go to the hospital, the emergency room, they don't have a doctor, you're all impacted because disease hits everybody, so I don't think that it makes sense to say, as some do on the right, that this is not something the government should get involved with. I didn't mention the thing with when you talk about your employees. I mean, I have people every day that come up to me and say, well, why is this they didn't mention Piscataway, but why is the municipal government providing health care for its employees? They shouldn't do that. Well, to me, it's ridiculous, but there are people that think that your employees should not get health care at all, that you shouldn't even provide it.
This is America.
I mean, I don't know.
Yes, ma'am. Just state your name.
My name is Francis, and I have a question. I've listened to what the bill does, what's the word I'm trying to say? Does for us, inadequately. It's inadequate, I understand that. So my question is, other than going to the polls and voting, I understand that, how do we as individual people make a change in what's going on in Washington?
I don't know how else to do it other than what Senator Smith said, which is to vote in the right people. Because right now, if you really were concentrating on the public's welfare, in my opinion, you would not have voted for this bill. And I think the only way that changes is if the politicians realize that they made a mistake in voting for this bill and that there's going to be consequences. Otherwise, they're going to say, so what? I voted for it, who cares? Or say, like Jeff says, well, we'll correct it, we'll change it later when things get worse. I mean,
So we have no recourse at all.
Well, I mean, we want you to be aware because public opinion is everything. You know who said, I don't have the quote, but it was Abraham Lincoln, I think it was said, the public opinion is everything, right? If you don't have the public opinion on your side, then you're not going to stay in office for very long. So what we're trying to do is influence public opinion and make people understand that this was not a good thing. So it gets changed by future elected officials. But right now, there's a battle. I mean, Republicans are out there now saying this is not going to negatively impact anybody. It's fine. It's not a bad thing,
And I think you also have to be a little more cosmic in your thinking. Right now, you're in the seventh legislative congressional district, or
What's
sixth?
that?
Six.
You're in the sixth congressional district. Frank Pallone is your congressman. He's not one you have to call and say, "What the hell are you doing? You're hurting me. You got to reverse it." Other people are. All right, in New Jersey, there's 3 congressmen who voted for the big, ugly bill, all ours. And if I'm being partisan, I'm being partisan. But that's the facts. That's who voted for what. And you have to be cosmic in your thinking in that you have relatives that may be in their districts. You may have relatives that are in Minnesota or California. You got to, the next time you have a family chat, you have to talk about what's happening to you and what's happening to the quality of your life. And you'd appreciate if they would contact their congressman or the U.S. senator to say, you're not working in my best interest. Because this is it's national. It's not just the state of New Jersey. Every state is going to get whacked with the bill. And people in other states also can participate in a democracy. You got to make democracy work for you. It's not working right now very well, in my opinion.
Piscataway since 1987. Mr. Waller, I hate to put you on the spot,
Okay.
but ultimately the bills have to get paid. How much of my property taxes going to go up? You got yourself a crystal ball there.
Well, all I could say is for the last year, the tax rate has gone down every year for the last 8 years. I can't guarantee this because we're concerned. Believe me, the mayors around the state, we're all chit-chatting. We have a weekly conference call. we're very concerned about this, and so are county commissioners throughout the state. And I know the 2 state representatives are concerned about it, because what happens at the federal level with reimbursements ultimately will roll downhill. Whether it trickles down or rolls down, either way, it has broad implications. I mean, as I said earlier in my comments, that we're concerned about the reimbursements for Medicaid. Is the town government going to get reimbursed for those employees that are on Medicare because it's primary? All that is a bunch of moving parts right now. And I know this has only been a month since, not even a month since this bill was signed into law by the president. So, and the other thing is, the congressman didn't mention, a lot of times even though Congress passes a bill and the president signs it, a lot of it's left to the rulemaking committees of those cabinet officers and their employees to write the rules on how this is going to be implemented, which could be way worse than what the intent was of what Congress, right? I mean, it has happened. And that's what we're concerned about. And believe me, we're on the phone with the Congressman's Chief of Staff, Matt, all the time about things like this. We're very concerned about it. I don't know what that answer is. We'll have probably a better idea early next year.
I was going to say, before the midterm elections, ideally, we'll have an idea.
My guess is you're gonna see the ACA cuts will be. You're going to see that on the renewals of a lot of people come January of next year.
That impacts now because
Yeah.
insurance rates are already being filed, well, not yet, but I think sometime in August with the insurance commissioner. And the people that'll lose the subsidy, that'll
Yeah.
impact them January 1st.
Yeah.
So I'm especially concerned about Robert Johnson Hospital, where
Yeah.
it's well funded, but obviously and I imagine the other survivors in here may also have similar concerns. So there's both the local level, but also the county level.
Yeah.
Thank you.
I understand what a budget cut is. I don't understand how monies that were appropriated, say, under the Biden administration for a period of time can lawfully be taken back by a subsequent administration. Because that's a breach of promise that affects the whole credibility and trust of the U.S. federal government. And I'm wondering, Congressman, if you have any insight as to what steps can be taken to stop that. I mean, is the only thing that municipalities or universities affected in this way can do is to pay lawyers to bring a lawsuit, or is there anything that you can suggest that could be done on a governmental level to stop what I believe is a terrible abuse of power?
Well,
I don't think everybody in the back heard it. I think the question that was asked was, with the budgets that were passed in the last 2 years that were appropriated by Congress, signed into law by not this president, how can they legally, meaning this Congress and this president, how can they legally take away that funding that was put in place by law? And that's what they call a rescission package. Go ahead, Congressman.
well, some of it is just they freeze it and they say, we're not sending you the money, right? And it's illegal, in my opinion. And that's why both the universities as well as the congressmen and what we call amicus, friends of the court briefs, have supported those lawsuits. But the problem is, you can bring a lawsuit, and we'll see what happens with a lot of these. In many cases, universities have actually won. But the problem is, they've lost the money. So, for example, I use Columbia as an example, right? Columbia, I think, just settled and said, we're going to pay the federal government as part of a settlement, we're going to pay the federal government $200 billion so that we can get something like $1.3 billion back in research. So they figure, well, you took away $1.3 billion, we'll give you 200, we'll still have 1.1 left, right? Now, I think it's absurd, right, that they're paying, and now they say Harvard may do the same thing, and then others may follow suit. I think it's absurd, but they use all kinds of excuses. And again, I'm not here to judge any of it, but like in the case of Columbia and Harvard, and there's others, Penn, and some of them are even in the red states too, like Southern Methodists and others. They have said that they are violating the law because of anti-Semitism, right? In other words, the universities are anti-Semitic, or they've said that their programs are based on DEI, right? In other words, they're asserting affirmative action. They're discriminating against white people in favor of minorities. These are the reasons that they cite as to why they're withholding the money. Now, is Columbia anti-Semitic? I mean, I have no idea. I mean, a lot of the faculty and administration at Columbia are Jewish, so you kind of wonder how anti-Semitic they can be. But these are the reasons that they cite. And now we're starting to see some settlements because they just can't afford to not have the research. I mean, remember, we're talking $1.3 billion to Columbia University. You know how many professors that is, how many researchers are, that had to be laid off. And so they just figured, well, we'll pay the $200 and we'll get the difference back, you know. But I mean, the whole basis for all this is, becomes very complicated. And I think it's terribly unfair, but that's what's happening.
Yeah. Is there any other question in the back there, guys? See somebody, just stand up and state your name.
Hi, I'm Marty Section. The speaker sent all the Congress home for the rest of the summer, right?
Yes.
What's going to happen from now till September?
Well, I don't want you to get the wrong impression. The session was supposed to end last Friday, right? Because traditionally we're not in Washington in August, right? What happened is it was ended a few days earlier because of the Epstein, right? In other words, the Democrats brought up a resolution that said that the Epstein files had to be released. I don't even know if there are Epstein files, but the Epstein files had to be released, okay? And that resolution ripened, meaning if we were in session last Thursday, it would have had to be voted on. And the Republicans didn't want to vote on it because they didn't want to have to vote to someone to release the files because the president didn't want them released. So they just sent us home the extra 2 days. But we wouldn't have been in session in August anyway, so I don't want to exaggerate it too much. And I don't even like to exaggerate the Epstein situation too much either. I think the files should be released. I think all the information should be released. But what's actually there, I have no idea because they don't release it. You can tell I love talking about the Epstein files.
Put your name right on it.
Anyway, good question. I don't want you to get the impression that we would have been in session in August. We wouldn't have been in session. But we were released a couple of days early. It's very hot down there, so it was nice to come back here for the extra 2 days.
Yeah. Well, thank you, everybody, for coming. If you need to talk to the Congressman, thank you for stopping by. You're always welcome back here in the staff.